Linda Blumberg, Dr. Blumberg, who is the Principal Research Associate of the Urban Institute. Thank you for being with us.
Mr. Chairman and distinguished members of the committee, thank you for inviting me to share my views on health insurance markets and health care reform. The views I express are mine alone and should not be attributed to the Urban Institute, its funders, or its trustees. Current health insurance markets suffer from many shortcomings. I'm going to focus my remarks on three that I believe are central and what I think we might be able to do under reform to address them. First, private health insurance markets are not very organized, making it difficult for individuals and employers to effectively compare options based on price, benefits, and quality of service. Second, individuals and employers voluntarily participate as purchasers, but too often those who would like to buy coverage face barriers to doing so, including problems of affordability and discrimination based on health status. Third, there is little competition between insurers, a consequence of a substantial amount of consolidation among insurers and healthcare providers in recent years, fueling the growth in insurance premiums. Insurance market reforms and subsidies to make coverage affordable for the modest income population within the context of a more organized health insurance market are essential strategies to address these problems. A health insurance exchange can be developed to organize the insurance market and to provide guidance and oversight in achieving reform goals. Making a public health insurance option available to purchasers can further promote competition in insurance markets and could be an effective strategy for slowing healthcare cost growth. Competition in private health insurance markets today focuses largely on obtaining the lowest risk enrollees. Insurance market regulations are required to prevent risk-selecting behavior by insurers. States allow insurers to risk select to varying degrees today so that they can protect themselves from the inherent nature of a voluntary insurance market, where individuals who expect to use significant health care services are those that are most likely to seek coverage. However, the consequences of allowing insurers to use such strategies are that many who need coverage cannot obtain it, and many who have some type of insurance may not have adequate coverage to meet their health care needs. In the context of a health care system that is universal, where everyone is insured all of the time, there would be no longer any reason to allow discrimination by health status, and coverage denials, benefit riders, pre-existing condition exclusions, and medical underwriting can be prohibited, with the costs of those with high medical needs spread broadly across the population. In such a context, an exchange can penalize or exclude from participation companies that violate insurance market regulations, establishing market conduct rules to prevent evasion of regulations. An exchange can also provide for risk adjustment to account for any uneven distribution of risk across insurers. Exchanges can also be designed to efficiently deliver health insurance subsidies, an essential element of reform intended to make coverage affordable for all incomes. Centralizing into a single agency, such as an exchange, the subsidy determination and the payments of subsidies to insurers would be a much more efficient approach to administration than under the HCTC experience we are having today. The exchange could exclude plans not meeting minimum coverage standards, ensuring that all have access to meaningful coverage. Exchanges can also play an important role in cost containment. The lack of competitive pressures in the current insurance market leads to higher prices and less cost-efficient practice patterns. An exchange can be given the authority to negotiate with health insurers over premiums. Other cost containment strategies would include requiring similar benefit packages be offered within an exchange to make it easier for consumers to compare prices for like policies, providing improved information materials and incentives to choose lower cost plan options. An exchange could also reduce administrative costs due to lower churning across insurance plans. Adding a public plan option to those offered within an exchange would significantly increase the cost containment potential of reform. A public plan could be modeled after the traditional Medicare program, paying providers based upon the payment systems Medicare uses, but with different cost-sharing rules and possibly some differences in covered benefits. Payment rates could be set between Medicare and private rates. Medicare payment policies have been shown to reduce cost growth relative to private insurers. A public plan could create competitive pressures necessary to induce private insurers to be tougher negotiators with the providers in their plans. The public plan could also be an innovator in the development of other cost containment mechanisms. It would also create a lower administrative cost option for purchasers, putting pressure on private insurers to hold down their own costs. I do not believe that a public plan option would destroy the private insurance market or lead to a government takeover of insurance, as some fear. Those plans that offer high-quality services and good access to providers would survive. Those that innovate and offer limited networks may even be able to offer lower-cost plans than the public option. I consider the public plan a very promising catalyst for cost containment, and one that I think would be considerably less of a dramatic change than other effective options, such as having the exchange negotiate rates on behalf of all participating plans or moving to an all-payer rate-setting system. Thank you very much, and I'm happy to answer any questions that you might have.